Delays in healthcare kill more people than any single disease. But what if that could change? One organization is proving that working hand in hand with governments is making healthcare accessible, affordable, and most importantly, effective, even in the midst of polycrises, regional conflict, climate change, and a decline in global health funding.
It's not about one policy decision, it's about people. And if people are willing to stay the course, they can overcome it.
This is the story of how One Health model helped drive one of the fastest gains in child survival ever recorded.
In a nutshell, what Muso does is to remove barriers for access to care.
This is Dr. Christian Rasangwa, and in this part of Africa where he works, the maternal and child mortality rate used to be some of the highest in the world.
When Muso was founded and started working, what we realized is that people are discussing mainly on who delivers care, but not how care is delivered. People are not actually bothered by malaria or diarrhea or pneumonia. It's more about, if I get sick, do I get the care that I need on time and without paying anything?
Muso saw the need. People were dying from curable diseases because access to care was either too limited or too expensive.
People have to make decisions, right? Do they have to miss their job or farming their land to go to the facility where they have to wait for 2 hours or 3 hours? They have to decide if they have to buy food or pay for healthcare. Understanding those challenges around geographical barriers, cultural barriers, financial barriers, quality barriers, infrastructure barriers. Now, we started working with the ministry to understand how we can build this together.
Christian oversees these essential partnerships, but it starts with Dr. Jume Jakite, Muso co-founder and country director in Mali, understanding community needs directly from the people facing those barriers every day.
One of the key components that brought success for Muso is the way we create things. We bring the services to their door.
This is Brigitte. She's what Muso calls a professional community healthcare worker and is a key component to their rapid care system.
Ça va chez toi, à tes voix en bas de tes yeux. Notre objectif, c'est d'avoir les malades plus vite possible, à partir de 24 heures.
When this woman's son developed a fever, she called the professional community healthcare worker she knew and trusted. Brigitte was chosen within the community and trained by licensed professionals. So there's an inherent trust when she provides doorstep service. She's meeting patients in their home to manage things like common illnesses, ensure children receive vaccines, and assist soon-to-be mothers to neonatal appointments. When an illness can't be treated at home, patients are referred to local clinics where nurses, midwives, and doctors can treat them or move them to a hospital for specialized care. In this case, that referral helps save this young boy's life. Through every step of that journey, this holistic care model came at no cost to the patient.
Bon, depuis entre le but, mais bien, on parle local, aux gens on veut comme avant, on fait là. En tout cas, ça va les care et les arbres.
The partnership with the government to Muso, I think it's one of the central pieces of our work. What we are doing mainly is to work with the government, is to say, okay, you have policies in place, you have strategies in place, but you're not having an impact on mortality, on morbidity. So how can we help you to put to better use every dollar that you are spending?
This is social innovation in action. An organization like Muso partners with governments, people on the ground who are directly impacted by the challenge, and funders. In this relationship, Muso helps plan, budget, train, and write grants, while the government helps to fund and use Muso's findings to create policies and infrastructure. It's co-creating and co-designing.
Our objective is to demonstrate things so that government could adopt that national-wide, and we could be there to technically assist them.
When you come to Côte d'Ivoire, we are told it's not possible. Why should the government of Côte d'Ivoire or Mali pay for this care without fees, not a new road, right? Because they have to make those decisions. and they need evidence. They need to understand that this is feasible. That's the starting point for us. It's really to work with ministries and governments to prioritize community health workers. They are becoming actually a backbone of the healthcare system. They are the first to catch these pandemics as they arise in the community, and they are held accountable by the community.
C'est pas difficile, c'est pas facile. Mais quand nous faisons avec le temps et qu'ils voient le résultat des soins que nous avons faits, la prochaine fois, ils nous appellent.
The work has been measurably effective in countries like Mali, where the under 5 mortality rate dropped from 154 deaths per 1,000 live births to just 7, marking the largest and fastest improvement in child survival ever documented. And the blueprint is undeniably achievable. Since working with governments in Mali and Côte d'Ivoire, Muso has been able to scale its model, enabling national systems to reach over 12 million people, and more to come.
Côte d'Ivoire taught me a lot that actually helped me to help Zambia, and maybe Zambia can help me to help Ethiopia in the future. So one country at a time, one community at a time. We have the tools, we have the technology, we have the evidence, and we are pushing that boundary of possibilities every day.